It's California Edition. I'm Brad Pomerance coming to you from Sacramento. We are joined by Jimmy Gomez, member of the California State Assembly, a new member. And I want to speak with you about your new job. How are you enjoying your time in Sacramento, sir?
It's been great so far. No, it's definitely an adjustment living in two places at once.
No doubt. You represent portions of Los Angeles.
Yeah, I represent the 51st District, which is northeast of downtown LA. Everything from Silver Lake, Echo Park, go Dodgers.
Right, I was going to say, beautiful areas.
Beautiful areas, all the way through Eagle Rock and all of unincorporated East Los Angeles.
Okay.
A large Latino population, LGBT, but it's very diverse. It is Los Angeles.
But some well-heeled areas as well.
Correct.
I mean, no doubt.
Correct.
It's a beautiful community. All those communities are quite beautiful.
Yeah.
I want to speak with you about healthcare, if we may, because I know that you had worked for the Nurses Association, so you have a sense of healthcare and healthcare reform, and you had mentioned that you're starting to look at the Affordable Care Act. Yeah. How are your constituents looking at the changes that are about to hit January 1st? I mean, some of your constituents, I'm sure, could benefit immensely from the Affordable Care Act.
Oh, no, it's definitely, the Affordable Care Act is transforming healthcare. I'm actually one of 3 freshmen that serve on the Assembly Healthcare Committee. And it's pretty significant because within 4 years, we'll probably be the senior members on that committee.
Right.
And often looking back to see how it's implemented. One of the main goals on its implementation, we need people to get enrolled in the different programs, either through Medi-Cal or through Covered California or through their employers.
And I want to ask about that because, look, this really is a sea change when you look at how we are addressing delivering healthcare and healthcare insurance. You mentioned there's Covered California, which is part of the exchange system. Then there's the Medicaid expansion. I mean, already I'm confused. How are you helping your constituents march through that process? Because some may be eligible for one and not the other, and then Senator Hernandez has the basic health plan for those that fall in the gap, and so it's a maze.
I think all Assembly members, including myself, have to do a lot of outreach to our constituents to educate them on the different components of the Affordable Care Act. What we're doing is a series of town halls on the Affordable Care Act, but also using, implementing and organizing some healthcare fairs within the district. The first one is in unincorporated East Los Angeles, and 135,000 constituents live there. And we're going to try to pull out, by providing health screenings and other services, direct services, about 2,000 to 3,000 constituents, and then we'll educate them on the process. So we want to kind of give them direct service while they're out there and then educate them on the process.
Is your sense that California is ready?
I think we've made a lot of progress further ahead than any other state.
One could argue.
But we still have a lot of work to do. We need to really focus on getting people enrolled. If people don't enroll, then the entire Affordable Care Act could have some problems.
Aside from enrollment, let's presume that we do have a high enrollment. Then there's the question of these individuals now can access primary care.
Correct.
And as you know, so many individuals who are uninsured would simply go to the emergency room. It's a real paradigm shift to go to a primary care physician, especially when we may not have enough primary care physicians.
Correct.
So where do we go on that front?
I grew up without health insurance. I know what it's like when I was 7 years old, I got sick with pneumonia, ended up spending a week in the hospital, and then my parents had to figure out how they were going to pay for the hospital bills. We didn't have the experience of dealing with one doctor. We had the experience of dealing with just multiple doctors in the emergency room. So we have to educate them on how to access health care throughout the entire system. Is it through a community clinic? Is it through a hospital? How do they sign up? How do they make appointments and focus on the preventative care? More people in the system will actually lead to decreased costs for not only for them, but for all of us by preventing any serious illness.
Right. For our viewers on HLN, we thank you for joining us. For our other viewers, we'll be right back. Assemblyman Gomez, I want to talk about another area that really is part of our health system, and that is the question of domestic violence. Because so many times victims of domestic violence wind up seeking health care, be it emotional, be it physical. That is an issue that you've been focusing on since you've joined the legislature. What can you tell us about domestic violence and your goal to try to decrease its frequency?
Correct. First, let me start by being in the Assembly. I get to focus on 100 different issues.
That's true.
Which maybe I didn't focus on before I got elected. One of them is domestic violence. I'm the chair of the Select Committee on Domestic Violence, and our main objective is to make sure that people are aware that this is an ongoing problem, not only in my district, but throughout California.
Why did you decide to become chair of that committee?
I thought, within the Latino community, folks have difficulty sometimes dealing with those issues for a variety of reasons: language, culture, immigration status. So I wanted to focus on an issue that relates to all of California, but also to my district.
Part of the question about reporting crimes often falls into the category of immigration status. We know in Los Angeles, I think it's Special Order 40, prevents any law enforcement official from referring someone who reports a crime to immigration officials. At some level, controversial. That doesn't mean, though, that people know that.
Yeah,
and so they won't report.
Exactly. And people are always afraid that they're going to be pulled away from their loved ones.
Right.
And we need to figure out, when it comes to victims of domestic violence, how do we give them the support and the courage and the information in order to get out of a violent situation that's also hurting their kids and their families.
We also know that over the last few years, our courts have been underfunded. That's not a political statement, it's just a statement of fact.
Correct.
There have been some attempts to restore funding, and we've seen some restoration, but not to pre-recession levels. And what winds up happening is when you have fewer judicial resources, crimes that are seen as less severe, like domestic violence, for whatever reason,
Correct.
wind up not being serviced in the way they should. Where do we stand on that question?
What we did this year was we had a $60 million augmentation to the state court's budget, and the executive officers of each court can decide how they use it. Some courts are tackling the issue of access directly by making sure that they keep their hours a little bit longer instead of closing them, making sure that the money goes to some interpretive services. We have a lot of situations where folks can't get simple access because there's no one to translate for them, or they have to rely on their child, who often it could be as young as 6, 7, 8,
and
9,
they're
10,
in school.
And they're in school, and they have to interpret a violent situation that occurred to their mother, often committed by their father. So how do they deal with that? So some courts are using that already to make sure that access is improved.
I also understand that some of the funding that California has for domestic violence prevention and intervention comes from the federal government. I also know that we are still under what's known as sequestration, and we know that the pain of sequestration, whether you support it or not, is starting to be felt. Head Start programs are being cut. Are we seeing those same types of cuts for domestic violence programs? How is sequestration impacting this area?
I'm not positive, but I know that we have to understand that access to, say, the courts and justice is not just regarding keeping our state courts open. It's also transportation. If you have to travel, 100 miles to get to the nearest court to file a restraining order on one day, and then you have to come back for your court date the next day, cuts to transportation funds is also impacting people's access to justice. So it's more nuanced. I think the federal government's sequestration cuts is just detrimental to every single program we have in the state, including anything that deals with domestic violence.
So since you've been here, no doubt, I'm sure you're glad you came when the state budget is in better shape than it was last year. But what are your constituents saying to you about what they hope you focus upon?
A lot of the issues I'm focusing on are the same issues that I talked about before I was running, and during my campaign, and now it's education.
Right.
How do we improve education in the states, but also the community colleges, not just K through 12. I'm a product of the community college system.
Got wound up at Harvard.
I wound up at Harvard, gave me that second chance to
I love it.
to improve my life, and
you'll come back?
We'll come back.
Okay, thanks so much. His name is Jimmy Gomez, member of the California State Assembly. My name is Brad Pomerance. You're watching California Edition. It's California Edition. I'm Brad Pomerance coming to you from our state's capital in Sacramento. We are joined by Cristina Garcia. She is a member of the California State Assembly. Congratulations. Your first bill has been signed by the governor. It's known as AB 331. What does it do?
Basically ensures that when an agency contracts out, for example, your local city with the county to run the elections, that they have to certify the elections and or go to a judge if they're not satisfied with the process. In the past, some cities have said, we don't like the results, we're going to do our own count, and they've reversed the results.
So you know well about shenanigans. You made your name as an activist against Bell corruption, the city of Bell. And a city not far from Bell, known as Vernon, tried to do that.
They actually did do that. They were successful in doing that. And this bill is not just about Vernon because they're not the only city to have done that. But basically, they contracted out with the county to be able to regain the public's trust, that they had a third party running a safe and clean election. At the end of the day, they didn't like the results because it took out some of the incumbents. The incumbents then decided not to certify the election, ordered instead that they do their own count. And at the end, there was a whole new set of results that kept the incumbents in their seats.
And there was nothing that could be done under state law at that point?
There was nothing that could be done. The only thing that could be done is if the citizens would have gotten together and sued the city, then maybe there could have been some action done. But that just adds a whole other level. And oftentimes the residents are not aware that this is going on. It's just, you might not even have the money to be able to hire the attorneys and get this done.
And isn't Vernon, I think it's the smallest city by population in the state? Is that right? Or one of?
It has about 120 residents.
Right, because it's really an industrial city.
Yes. So, and so even if it's just 5 ballots that you toss out, it's a really big deal.
No
it's
doubt.
That simple.
I want to speak with you about your community as well and focus on the Affordable Care Act, which is coming right around the corner, January 1st. You represent some areas with high populations of economically disadvantaged, often English language learners. Are they getting the message about the Affordable Care Act and the benefits which might be available to them?
So about half of my constituents are actually going to be eligible for benefits through this.
That's huge.
If they're not already.
And you have about 450,000 people in a district, so that's huge.
So it's something that affects. I have a lot of folks who are naturalized citizens or here legally as citizens who Spanish, which English is not their first language. And so definitely I think reaching out to these populations is really important. I've been working closely with the Congresswoman and with Cover California to run a number of workshops in the district. Which is the
healthcare exchange.
To cover, to target different populations. And so we've also been doing it at the community colleges to make sure it's accessible to the young folks, which is an important vehicle, not just because we need them to sign on, but I think about my own case. It's often the case that I have to do the research and I have to tell my family, hey, this is what we're going to do for these reasons. And they will also, now explain that to our neighbors too, or people will just knock on my door randomly.
How do we change habits though? Because in the final analysis, so many of these economically disadvantaged are so used to just going to the ER when there's a medical issue. They're not used to primary care physicians because they could never have one.
Well, I think that's part of the educational process. I think and the young people, once again, there's a survey out there that AARP did that shows that young people want to have insurance if it's affordable. So I think, we don't want to land in the emergency room. All of us have been there at some point, and when you're waiting 4 or 5 hours, it's not where we want to be. We want to be able to be proactive about our health. So I think the change is going to come. It's going to be how do we outreach and educate folks, and how do we get rid of the misnomers out there.
What about the distinction between the healthcare exchange and the Medicaid expansion? Because different populations can apply for those two programs.
Yes, so I think the first thing is if you are already on Medicaid, this should not be affecting you. There's a lot of fear that somehow you're going to get shoved off, you're not going to get to see your doctors, that you already have a relationship. So first of all, if you're there, you're taken care of. If you're not there, we do have folks who are going to be eligible and are going to get onto those roles to get out to. We're going to have navigators to get them there.
When we come back, we'll talk more about it. I'm Brad Pomerance. For our viewers on HLN, thanks for joining us. For our other viewers, we'll be right back. Assemblywoman, I want to speak with you about what's known as cyberbullying. It is a trend that is horrifying. I have daughters, they're tweens, and it's remarkable how easily it can happen. I made the catastrophic mistake of getting my 11-year-old a phone. She's responsible, but I can see what could happen just via tweeting with Instagram and texting. What do you know? What do you see?
I mean, I think giving your 11-year-old that phone is really the direction we need to go. I think you need to do the next step of, are you checking her text messages?
Yes.
Are you checking her Twitter,
Yes.
her Facebook, wherever she's at? And not just checking to see what she's doing, but how are other folks interacting with her? What are her friends doing? And then helping to build that consciousness of what's right, and then giving her the strength to intervene when someone's being bullied. But what's happening right now is that our educational system, as a teacher, kids look to us to protect them.
And you have been a teacher.
I've been a teacher for 13 years.
High school?
I've done everything from middle
That's
school
what I thought
to the
so.
university.
Right, that's what I thought, right.
But there's a certain level of trust that our students have in the teacher saying, you know what, when you see something going on, you're going to intervene, you're going to fix it, because my peers might be afraid to do it because, you know, they might be bullied too.
You know what's stunning to me? I had a friend show me a text message that a mother sent to 9 fifth graders attacking one of those fifth graders. A mother of another fifth grader. I was stumped.
And it's bad enough when it's amongst
Right.
kids. And that is, I mean, an adult should never behave in that manner.
But we know it's happened. The Texas case with Facebook and the suicides, I mean, we know about it.
And this is why our educational code needs to catch up to the society, to the reality that our students live in, and they have to rebuild that trust between the teacher and the students and the school. Because right now, schools have tried to intervene, and they've been sued because technically cyberbullying is not happening on campus, so we can't do anything about it.
Be very specific about it, because I think there's some confusion about the jurisdiction of a school. As we speak today, what's the law?
As we speak today, if the bullying happened on school grounds during school hours, then the school has the ability to intervene.
So if the texting happened that was bullying during third period, fine. But if the texter was at the local mall, nothing the school can do.
And the issue is that the reality is that a lot of schools have a lot of policies against these phones, and so it's not happening on campus, it's happening at home. But what happens is everyone sees it online, and it's not to one person. A text message goes out to one, it's to millions of people, and it's there for everyone to see. It's a different avenue.
Right.
And so you come back to school, everyone's talking about that. Kids want help. Kids want to help someone else, but they're afraid they're going to be the next one bullied, the next one attacked. Victims get re-victimized online constantly by other people because it's how they've tried to justify it. And so we need to allow schools to rebuild that trust with their students, that they're going to be okay, while we figure out the mechanism to help parents, help students do the right choices.
So let's talk about a bill that, as we speak today, you have authored. We'll see what happens in the final analysis. It has received bipartisan support, but what would your bill do? My
bill would basically add 8 words to existing codes.
That's it,
8 words. It would not change traditional bullying language. It would just say that in cyberbullying, if it gets to the point where the teacher can no longer impart their lessons, the school can intervene. That's all.
So it doesn't matter where the cyberbullying occurred. It could have occurred at the mall, at the home of the student. At that point, there is jurisdiction to intervene.
Yes, as long as it's interrupting the lessons and we can no longer move forward. It doesn't say what you have to do, how the school intervenes. A lot of folks have said, oh, there's going to be more suspensions. But I think most schools realize that it's not about suspending, it's about creating a dialogue and giving skills the ability to make the right choices.
I want to speak with you about the makeup of our legislature. I've said this before, I'm the father of 2 daughters, and so it's nice to see women succeed. I like seeing men succeed as well, but it's nice to see women in power. And interestingly, maybe 20 years ago, we were at the zenith of that with the Anita Hill hearings. In California, I believe we're seeing a diminution of female representatives in Sacramento.
Yes, actually not just in Sacramento, across the whole state at all levels, we're seeing less and less. It's one of my top priorities and it's one of my top concerns. I showed up here and I left a career that I loved. I love being in the classroom and I miss it on occasion, and I know that this is a privilege and I'm excited to be here. But I thought about, I have the potential to be here for the next 12 years.
You do.
Am I comfortable with the landscape? And I wasn't. When I saw that we were only 1/4 of the population and we're decreasing in numbers.
1/4 of the legislature.
Yes, where are we at in leadership and we're not there at the same levels as the men. I have a big problem, and I always challenge my peers, well, no matter how many Republicans or Democrats we have, half of the leadership and half of the positions will be filled by Democrats and half will be filled by Republicans by default. Why don't we have that commitment to female
Bean
members?
County?
I'm just saying, at some point you have to do what's right while we get there and we get more folks in here. We have talented women that will step up to the plate, that will work hard.
Come back and talk about it. She's Cristina Garcia. When we come back, we'll be speaking with Anthony Cannella, member of the state Senate, who has a bill dealing with revenge porn on the internet. I'm Brad Pomerance. We'll be right back. Welcome to California Edition. I'm Brad Pomerance. We are coming to you from Sacramento, and our guest is Anthony Cannella. He is a member of the California State Senate. And so I'd like to speak with you about technology and advances in technology, which has brought about tremendous benefits to our society, but some scary consequences as well. Give me a sense of one scary incident with regard to a woman that we know as Holly Jacobs.
Yeah, so the issue, it revolves around what we're calling revenge porn or cyber revenge, and it's where a couple could be in a relationship, a trusting relationship, and they share intimate pictures digitally. There's a breakup, and one of the parties takes that opportunity to use those pictures in a way that they were never intended, and they would post them on the internet with personal information. So not only pictures, nude pictures,
right,
but also personal information, cell phones, home address, place of business, business phone numbers, and it's really meant to harass the individual. So it's a scary phenomenon that's happening. It's happening a lot more than we think.
And that's what happened to Holly Jacobs. She was in a 3.5-year long distance relationship. It ended, and allegedly her ex-boyfriend posted these photos on over 200 websites. Yeah. What's remarkable to me, Senator, is that there's no law that prevents the posting of pornographic pictures of adults without consent. I can't believe that.
No, it's true, and so the technology is moving faster than our laws can.
Right.
And law enforcement has no tool to combat this, and so we were approached by victims and were asked to look into this, and what I found out, again, it's very widespread. And so that's why we introduced SB 255, which aims to deal with it. And what it would do simply is make it a misdemeanor with punishable up to 6 months in jail and a $1,000 fine. Whereas now the only recourse for a person is to sue them in civil court.
Right.
Well, the perpetrators, the ones that do this to people, they don't care about that because they know, the
it extends the pain.
Yeah, the victim will not do that because they're already traumatized by that. They don't want their parents to know about these pictures. They don't want their friends or their employer to know about that. So they'll usually just hope that it goes away. And the reality is it's not going away. So law enforcement needs a tool.
I understand that the bill has done well in both houses of the legislature. The governor, though, has been reticent to sign any legislation that increases the number of prisoners in our state. This obviously would not send prisoners to state prison because it's an under 3-year sentence. Do you have a sense as to whether, because it does increase the number of prisoners?
And that's a fair point, but I made it through the Senate Public Safety Committee unanimously, and that's usually where the bill's done. That's where we have the so-called ROCA file, where if it increases the number of prisoners, it just dies. And in this case, not only did it pass, but I also got the chair to be a co-author of the bill. So again, look, we can't just give up just because our prisons are overcrowded.
Right.
We have people that are being victimized all the time. And SB 255, I think, is an important step that we can take to help those victims.
I want to shift gears, if I may, and speak about high-speed rail. It continues to be very controversial, despite the fact that voters did pass it, but voters have been coming out and saying, we're frustrated, we don't know where the money is going, we don't know what the path will be. What can you tell us about voters' views of high-speed rail, especially in your area, which is kind of central California, where high-speed rail is intended to begin its construction?
Well, I think there's a lot of concerns because, look, my concerns have been, number one, I don't like the route. I mean, it's cutting through prime farmland, and I think there are better locations. It could have gone down 99 or I-5.
Okay,
would have been a lot
those
cheaper.
roads. Mm-hmm.
Number two, my concern is it's not funded. So it's a $68 billion project, and we've got about $11 billion in funding, $12 billion in funding, maybe. So we don't have the total funding. So those were my concerns. That said, the legislature voted to appropriate the funds, and it's moving forward. And so really now it's my goal to make sure that that money is spent as efficiently as possible.
When we come back, I want to continue this conversation if we can. His name is Anthony Cannella. I'm Brad Pomerance. For our viewers on HLN, thank you so much for joining us. For our other viewers, we'll be right back. As you said, Senator, the money has been appropriated, at least $11 billion. But the challenge becomes there are individuals who still are committed to killing the project. Despite the fact that there are federal funds attached and money appropriated through California. And I'm not taking a position, but where do we go with this desire to not kind of admit the project is moving forward?
Well, the project is moving forward, so whether we want to admit it or not, it is moving forward. And I think the public is concerned that we look at the Bay Bridge debacle where $1 billion initial price tag, and now it's up to $7 billion, and they're afraid that same thing is going to happen to high-speed rail. And so I've been very involved in the Bay Bridge, and I'm going to use that experience that I've learned about what's happened to make sure it doesn't happen on high-speed rail, because again, it is moving forward, and whoever's fighting, they can continue their quest in court. I get that, but my goal is, if we're going to spend taxpayer money, that we do it the best that we can and minimize the issues. And so really that's my focus right
We
now.
also know that the funding mechanism and the funding for the project is bollocksed up in court. And in fact, recently one court ruled that the funding requirement didn't meet the voters' intent and that environmental reviews weren't done properly. And so, you know as well as anyone, any major project can get caught up in a litigation nightmare. Yeah. And so it begs the question, where do we go from here, given that litigation for this or any other matter can be used as a weapon?
Yeah, no, that's the issue we face when we do anything in the state. Our environmental guidelines are high, and that's not a bad thing. Mm-hmm. But on that particular court case, the judge did not stop the funding. He said there's an issue, and so they're going to reconvene to discuss it.
They are.
But again, look, I'm a member of the legislature, not the judicial branch. They've got their job, I've got my job, and regardless of what a person's position on high-speed rail, it is moving forward, and it is moving forward in my district. So again, the goal should be minimal impacts to people and ag land, and make sure that when we spend that money, we're spending it the best that we can and to minimize mistakes. And there's a lot to learn from the Bay Bridge. Let's take that and let's apply it to high-speed rail, because we are moving forward with it.
What about what's happening in Washington? Because your counterparts in the Congress, many of them from the Republican Party as an example, are just committed to do everything they can to kill the project. They're trying to zero out the transportation budget for this particular project. Congressman Denham, Congressman McCarthy, they're very clear that they just don't like it. And so I know that's not in your control, but that being said, you do represent similar areas, if not overlapping areas.
Right, and there's a lot of concern from my constituents in the Central Valley. Now, there's a lot of people that want it, right? It's a lot of jobs. It's many billions of dollars being pumped into an area that has very high unemployment and very high poverty. But again, I'm not going to fight fights that are already over. So for Congress, that is a legitimate fight, because we're going to need more money from the federal government to build this thing.
We will.
In the state of California, that's in the rearview mirror. That fight's already been. I did not support it. I voted against it. I was in the minority. The project's moving forward, and it's my job now as a representative of the 12th Senate District to make sure that if we're going to build it, we do the best that we can.
Now, the first leg, I believe, goes from Merced to Bakersfield. Is that right?
It's Madera to Bakersfield it's actually Madera to Fresno, and then Fresno to Bakersfield is the next one.
And does your district include some of that area?
It does. I represent Madera, and then the new district that I'll represent is the western side of Fresno County.
So you really are right in the thick of this.
I am, yes.
And so many of the folks that have been hammering at this has been the farmers that you mentioned. Mm-hmm. And so do you sit down with them? Have you sat down with them to try to come to consensus? Because all I hear and see is just fighting and screaming and litigation.
And I think that's fair, but I would say that a lot of the problems that we're faced with, I'm not talking about the finances of the project or whether we should do it, but a lot of the angst with the ag community has been the original high-speed rail authority did not deal with them well. They were arrogant. They told them what they're going to do, and they just were very disrespectful to the farmers. I would say that the new authority, the folks that are in charge now, have done a much better job of reaching out to the ag community. Now, it's still a controversial project. We're still going to have our issues, but I think they've done a lot better job reaching out to the public.
So in terms of the beginning of construction, it was supposed to be 2012, then it was 2013. We hear 2014. Yeah. You think it will happen?
I do.
Really?
Yeah, again, unless there's some litigation that holds it up. They're awarding a contract. They're working. They're actively working in the area, identifying right-of-way, trying to acquire right-of-way. So it's working. It's moving forward.
We'll see. His name is Anthony Cannella. He's a member of the California State Senate. My name is Brad Pomerance. We thank you so much for watching California Edition.